Hello, this is Bob Goldberg from Robert M. Goldberg and Associates, and I'm hosting a series of webinars. And remember, friends, do not let friends spend down. We're going to be talking about qualifying for nursing home Medicaid without losing all of your assets or your mind. And today the focus is going to be on income considerations for a single person. We have Atlanta offices, Griffin offices, and Peachtree City offices. So give us a call at 770-229-5729. If you would like to talk about your specific circumstances, you can visit us on the web at www.goldbergestateplanning.com. Now, I've been practicing elder law for over 21 years, and I'm going to talk about how you can help someone you love qualify for Medicaid so they can get the care they need without going broke. Let me explain my why. At my firm, we deeply believe in helping caregivers take care of everyone and everything they love. Elder law is about planning for chronic disability, something that doesn't get better. So I've decided there's three key questions. Where will you live if you cannot take care of yourself? Who is going to help you take care of yourself? And the all-important third question, how am I going to pay for care without going broke? Now, holy cow, the average cost of care in Georgia for 2020 is now $8,517 a month. That's a 26% increase since last year. And there's basically only three ways to pay for care. You can private pay, you can pay for it with long-term care insurance if you have that, or you can qualify for Medicaid, which is medical aid as distinguished from Medicare, which is health insurance for people over the age of 65. Now, Medicaid has a couple of tests, and today I'm going to focus on the income test for single person. And I'm not here to make you an expert. I just want you to know there's a lot of misinformation and disinformation out there in the public. So I want to give you some advice from an experienced professional so you will have a little better understanding of the rules. Now, why elder law? Well, Medicaid is governed by federal law. It's governed by the Social Security Act. That's why it's a good idea to get help from an attorney when applying for Medicaid. Nursing homes will help you, but they're practicing law without a license, and they might not advise you about all of your options. Working with an experienced professional like me gives you peace of mind. You are working with someone who not only knows all of the rules, but the exceptions to the rules. Now, Medicaid was established in 1965 under Title 19 of the Social Security Act, and it's a federal state program of medical assistance for low-income individuals who are aged, blind, or disabled. Medicaid will cover most of the cost of long-term care after the patient has reduced their financial resources to certain limits. Now, remember, today I'm just going to focus on income considerations for a single person. Later webinars will cover other issues related to married couples and resources. So, what is income? Income is anything received on a recurring basis. It could be Social Security, it could be pension, it could be annuity payments, it could be required minimum distributions. And Medicaid has an income cap for people applying for nursing home Medicaid, and they're going to look at your gross income. In 2020, this income cap is $2,349 per month. Now, what does this mean? Well, if you just have $2,000 a month in income, you qualify for Medicaid. If you have $2,500 in income, you don't qualify for Medicaid. To learn about what the cap is, you can look online. It's adjusted on January 1st each year. Let's look at a case study. We're going to look at Marianne. Now, Marianne has $820 in Social Security income, and she's a single person. She's widowed. She has a nice pension of $2,348 a month. So her total gross income, as you can see, is $3,168. And doing a little bit of math, we can see $3,168 is greater than $2,349. Marianne's over the income cap, yet the nursing home costs $7,500 a month. So she has a problem. Well, here's the solution. Thank you, Mrs. Miller. Mrs. Miller was the first case where there was a qualified income trust established, and she was in the same situation as Marianne. She was totally disqualified from Medicaid assistance. Now, the Miller case says that the person applying for Medicaid or their agent under a power of attorney can create what's called a trust. And a trust is merely an agreement between a trust maker and a trustee. And in a Miller trust or a qualified income trust, the only thing that can go into the trust is income, pension, Social Security, and other income of the individual. And as long as this trust is set up properly and is administered properly each and every month, then Marianne will qualify for Medicaid. But anything that remains in the trust upon Marianne's death has to be paid back to the state up to an amount equal to what they paid for her care. So that's the Miller Trust in a nutshell. So now let's move on to what's called patient liability cost share. Just because Marianne qualifies for Medicaid, that doesn't mean she doesn't have to pay anything towards her care. Patient liability cost share is what the Medicaid program calls copay. And there's certain deductions are allowed, and then whatever income is left has to be paid to the nursing home each month as copay. So let's look at the allowed deductions. Health and dental insurance premiums may be deducted. That could be the Medicare Part B premium for outpatient services, the Medicare Part D premium for prescription drugs. Something that's paid for a Medicare supplement, the premium for that would be deducted from cost share. Another deduction for a single person is the personal needs allowance. That's the amount Marianne's going to be allowed to keep to take care of her personal needs, and it's currently $70. So looking at Marianne's case, we're calculating her patient liability cost share as follows. She's got total gross income of $3,168 minus her Medicare B premium of $144 minus her Part D premium of $45 minus her personal needs allowance of $70. That leaves $2,909 that's going to go to the nursing home to pay Marianne's cost share. So instead of having to pay $7,500, Marianne pays $2,909, and Medicaid is going to make a vendor payment to the nursing home of $4,591. That's what the state is going to pay. So I've talked about the income cap in a single person case. I've talked about creating a Miller Trust or a qualified income trust to qualify for Medicaid, even if the applicant is over the limit. I have talked about how to calculate patient liability cost share. Remember, the number one estate planning mistake, the number one elder law mistake is procrastination. Don't stick your head in the sand if you have a problem. It's not going to go away. I thank you for watching my webinar. I will be adding more relevant content on other elder law and estate planning issues. If you need to schedule a consultation, I call that my discovery meeting. Call me at 770-229-5729 and we will make an appointment for you. If you want to learn more about our firm, go to www.goldbergestateplanning.com. Thank you for listening and watching.